myself Dr. Anagha, Senior Physician, Apollo Ayurveda, New Delhi. Today we will discuss about frozen shoulder. Frozen shoulder or adhesive capsulitis is one of the most familiar conditions that limits the movements of the shoulder joint. It is generally characterized by pain which starts slowly but steadily and gets worsened over a period of time. Initially, it might begin as a diffused, dull aching pain that usually get intensified during the hours of darkness and disturb the sleep. Meanwhile, the stiffness and progressive restriction of the movements may set in, disturbing certain range of motion of the shoulder joint. Later, the pain becomes little more frequent and consistent with limited overall movements of the joint. What exactly happens in frozen shoulder? Our shoulder joint is enclosed by a joint capsule that encapsulates the entire structure of the joint. Main function of the joint capsule is to stabilize the joint, distribute the load throughout, and to provide passive stability by limiting the movements. So, when the joint capsule, which is basically a fibrous connective tissue, become thickened, stiffened and inflamed, that results in this particular condition known as adhesive capsulitis or frozen shoulder. Major risk factors include diabetes mellitus, cervical disorders, stroke, rheumatoid arthritis, Parkinson's disease, thyroid dysfunction, etc. Being a disease of shoulder joint, which has a greater role in our day-to-day activities, this condition seriously affects our daily routines. Even though frozen shoulder has a fair restoration rate, it usually tends to recover very slowly. Presentation of apabahuga in Ayurveda coincides with the symptoms of frozen shoulder. Treatment protocol for apabahuga or frozen shoulder is to be designed upon the proper assessment of the patient and real root cause analysis. In Ayurveda, apart from the patyahara viharas, that is right food or right diet and right regimen, we have promising treatment strategies which can effectively address this condition, but that has to be selected according to the underlying cause as well as the symptomatic presentation. Treatment options include Shamana as well as Shodhana Chikitsa. Shamana in the form of medications. Medicines may be anti-inflammatory or which has a capacity to reduce the degeneration, or might be we have to select the medicines for the primary disease which has resulted in frozen shoulder or adhesive capsulitis. Shodhana Chikitsa like Nasyam, Potleys, various dharas or vastis are seen to be very effective when selected according to the condition.